Chapter 14, let's chat about health insurance. Health insurance has certainly changed in this century, even in the last 2, 3 decades, and I can only imagine, I cannot envision where it will be in the next 10 or 15 years. But let's talk about today's health insurance. So, page 14 starts out with learning objectives, the chapter outline, lots and lots of key terms. Um, I, I've said this all semester. I do not expect you to be experts with these key terms, but it would be very beneficial for you to know where to look them up and how to find the definition conveniently. Page 288 starts the discussion of the chapter 14. The introduction is listed there. It goes into the history of health insurance. Health insurance, has not been around that long, and the changes that occur frequently are in an effort to improve the benefit, the outcomes, overall health of a human being, etc. Health insurance, the policymakers and the lawmakers aim to provide coverage for everybody, really to prevent illness. That's been a recent shift in healthcare. I would say in the last 20 years, they're they are covering, when I say they, I'm referring to the lawmakers and the policymakers and those decision makers who dictate our health insurance. Anyway, they're focusing a shift on prevention, wellness to prevent, diseases like diabetes from ever happening instead of just waiting for it to happen. So anyway, let's get into this chapter. Health insurance today is discussed on page 289, the healthcare reform that happened back in 2010. Of course, now, if it was enacted in 2010, just imagine how many years, decade plus, prior to that these changes came about. And our health insurance legislators do take input from healthcare employees, if you will. So nurses had a really strong backing in the healthcare reform of 2010. In the American Nursing Association, they listened to the feedback. Medical doctors, providers of different levels, everybody, we all as a healthcare community, we truly don't do want the best for our patients. And so we push for change from time to time. That's why you'll see health insurance change in the next decade. Okay, page 290, then page 291. Health insurance terminology. That is key. This is part of our weekly discussion, and you'll see more information about this on your quiz and a test. But you must know, as in the healthcare world, especially in a medical office or somewhere at a front desk, front office, billing, accounting, you have to have this knowledge. This is key essential knowledge in that realm. Not necessarily folks on the front line, like a phlebotomist, a nurse, dental hygienist, respiratory therapist. I mean, it's great to have a roundabout knowledge, but truly the person who's registering a patient, accepting a payment, this is the type of information that you must know. You just really must know. Now, I'm not saying this to tell you to memorize this chapter because, again, remember what I said, it's going to change. And by the time you get to where you're going in a career or a job field, laws change and also technology changes. So, what if maybe one of you can develop an application to combine all this information and knowledge and the ins and the outs, and with the click of a button, there's all your answers. So anyway, I'm wishing, I'm dreaming, because health insurance is very evolving, challenging, and when things change, you do not want to be wrong. You do not want to tell a patient, oh, you only have to pay $50, when indeed, as of January 1st of the year, their copayment is now $150. That's a huge difference. And the healthcare consumer, I will say this out loud. I think I've said it before in other videos. It's our responsibility to know our insurance policy. It truly is. But health insurance is very challenging, and many healthcare consumers do not know the ins and outs. Even myself, as a healthcare consumer for preventative procedures, I have to go look at my policy and remind myself of the terms and the definitions and what does this mean, especially when it comes to co-insurance. Like, I got it, but I do have to refresh my memory. So just imagine someone who does not know anything about healthcare, health insurance, the coverage, the terminology. So the healthcare staff, the medical office staff, must be well versed in that so you can help, because laws and ethics will tell you that it's a team approach. Like, it's your responsibility also to help that healthcare consumer navigate this. And of course, it's just the right thing to do. You would never want to book someone an appointment and they think their copay's $10, and then the patient arrives and you're trying to collect 100. That is huge on somebody's budget. Um, so yeah, just keep that in mind. Okay, page 292 starts the discussion with deductibles. Be sure to read through that, review the scenarios, let me know if you have any questions, and then co-payments and co-insurance on page 292 into 293. These are some real key things, and this is what's really going to impact your patient mostly when they're in front of you, when you are collecting that information, that billing the monies at an appointment. So, huge thing to know as a medical office manager or medical office employee. Page 293, there are lifetime maximums. Waiting periods are discussed. There's exclusions. Holistic health care has even started to be covered by some insurance companies, not all of them. Alternative medicines like cupping, massage. That's what the holistic is. That this is more new. It's been accepted more in our nation, I would say, in the past 10 years. Types of health insurance plans. Let me go back. I didn't finish my thought. It's being more accepted lately, um, because it's proven to work. Many of those alternative methods of holistic caring, there is genuine evidence, data to support those practices working. It's just taken our laws and our policymakers to catch up in accepting change, if you will, and allowing that type of stuff to be covered by our insurance. Page 295, the different types of insurance plans. I wish I could summarize this and make it conveniently easy for you, but I can't. You're just going to have to read through it. On page, oh, I don't remember now. There is a nice, on the right-hand side of the page. Hang on. Let me see if I can find it real quick. I'm not going to be able to put my fingers on it because I want to. On one of these pages, I promise, in chapter 14, the right side of the page, there is a column. Oh, wait, here it is, 289. This breaks down the different types of insurance plans, or the insurance, yeah, plans, I guess, that I was going after. Okay, bear with me. Let me go back to page 295. 289, that's just a great summary, that column. That's a clean cut. Here, this is what we offer. Page 295, it starts discussing the different types of plans. It'd be really convenient if that column was on page 295. But anyway, moving forward. Okay, so read all about that. Health maintenance organizations is probably one of the most common um, policies that, especially if you work for a corporate company, they get great. They can hang on. What's the word I'm looking for? They will agree, they will negotiate. That's the word I was looking for. An agreement on how much, for example, WakeMed has health insurance that costs X amount of dollars per month, where another company, I'm trying to think of companies in Wilson, and I'm just struggling today, you all. Target, we'll say Target or Walmart, retailers like that. They have negotiated insurance for their employees for X amount of dollars per month. Not necessarily if a company has larger number of employees, do they get a better discount. That is not how that works in that realm. But HMOs, the health maintenance organizations, are the most common for those type of employers to offer their employees. PPOs are usually an option too. They're just not as common. Exclusive provider organizations, point of service, capitated plans, please review that. COBRA coverage, this is in the event of job loss. If you do get laid off, or if you change your job, there are COBRA options available for health insurance, but let me tell you, they are expensive. They're very expensive. And then page 299 speaks to the individual health insurance policies. Flex spending account and savings accounts, these are great because you get a tax break. These are pre-tax dollars that you put into these type of accounts, or you can buy eyeglasses, certain medicines, weight loss programs could be covered. So again, great option if your employer offers them. Consumer directed healthcare plans, elective procedures are not always covered by insurance companies. You have to really, really look at your information that is provided, what your benefits do cover. But typically, I'll say it again, elective procedures are not covered by insurance for the most part. Sometimes they are if the insurance company can see the benefit, if that small cost or that procedure can help save them thousands and millions later down the road, then they will pay for an elective procedure. Um, I've said this too before, and please, this is exactly where this comes into play. Healthcare is a business. These lawmakers, these insurance policymakers, they are looking at not only outcomes, but they're also looking at the money. So please know that. Prescription drug coverage is a benefit for many health insurance plans. Each formulary is different, though. You have to, if I'm on this medicine and maybe I only pay $10 a month, but if I change my health insurance policy and go with a different company or a different level, then suddenly my medication may become $100 a month. And that comes down to the formularies with the prescription drug coverage. You as a medical office personnel probably wouldn't have to know the exacts with the medicines, but guess who would? The local pharmacist, wherever the patient gets the prescription filled, they need to be very, very familiar with the formulary and how much it's going to cost the patient. But again, a patient or a healthcare consumer should know too. They need to investigate also how much their medicine's going to cost them. All right, I'm going to quickly go through the rest of this chapter. I feel like I am taking too long. Medicare is reviewed on page 303. NPI, that is a unique number that is assigned to providers for prescription purposes, billing purposes, etc. Medicare Part A, Part B. And see, this is as of print of this book, the time of this book, which was whatever year it was. And just know that here in 2024, there have been changes to Medicare Part A and Part B. And so that is a medical office manager's responsibility to stay up on those changes. Part C is listed there. Advanced beneficiary notice. Yes, waiver must be signed. Yes, so if Medicare is not covering a procedure, then you have to give your patient the ABN to let them know they may have to pay cash. So, for example, cataract surgeries, I just happen to know this because I worked in the OR for several years. Medicare will pay for the surgery, but they don't cover the lens that is replaced. When the doctor finishes the surgery at the very end, they put in a new lens. The patient has to pay out of pocket for the lens, which it's like, gosh, you're covering the surgery. Why not pay for the lens? But that's just how it is. That's how the policy is. So the ABNs have to be shared, explained, and signed by the patient so they can cover the cost of that $300, $700, $800, $2,000 lens, whatever the lens may be, whichever one they choose. But again, Medicare will cover the surgery, just not the lens. Page 305, there's an example of the ABN. Oh, there's Medicare Part D on page 14. Secondary insurance, Medicare, just, yeah, keep reading all that. Then we have Medicaid on page 307. It's a whole different, not beast, that's not what the word, yeah, I guess I'll just say it's a whole different beast. Medicaid is different than Medicare. So review that, review what your chapter has to offer. The State Children's Health Insurance Program, CHIP, that is on page 309. TRICARE is for our military. CHAMP VA is also a military veterans program. 311, insurance for accidental injuries is listed there. There's disability insurance, processing claims. When it comes to medical claims and patient registration, there's important information reviewed. Verifying eligibility. This is huge, just like verifying patient ID. The identifying someone and confirming identification is just as important as verifying eligibility. Coordinating insurance benefits on page 315 if you have a Medicare patient that does have Medicaid and or a Medicare patient that has private insurance alongside of it. There has got to be a coordination of those benefits. Who's going to pay for what, and how do you know who to bill as a primary or secondary? Page 316, referrals, documenting calls. Oh yes, we got to document. You got to document. If it's not documented, it wasn't done. Health insurance claim forms. I love this example they give you, but I doubt that's used in today's practice. Maybe it is, but most everything is electronic. timelines, electric billing, and then the chapter review on page 321. Let me know if you have any questions.